Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life in Balance. And today we're going to talk about something that I brought up in, I don't know, probably April of last year, May, when the beginning of COVID, the people with respiratory problems like COPD and asthma were scared to death that their condition was going to put them at great risk for bad outcomes with COVID. However, at no point did asthma and COPD show up on the list of comorbidities that are a problem with COVID. And that hasn't changed. I think there's a lot of asthmatics that are still terrified, but they don't actually look at the list to see that they're not actually on it. There were some initial theories that maybe those people were very hypersensitive on the front end, that they were already being very careful. But there was also this discussion that maybe their routine use of inhaled steroids could be playing a role. And sure enough, we have this study that was just published, non-peer-reviewed. They looked at the use of Pulmicort within 7 days of people who were diagnosed with COVID-19. It was 139 patients with mild symptoms, and they looked to see how many of those people using the inhaler versus placebo versus the inhaler group ended up in urgent care or the emergency room. And out of that group, there were, in the control group, the people who didn't use the inhaled steroids, there were 10. In the Pulmicort group, there was only 1. Now, small number of patients, I'm going to get to that in a second, but clearly there was a difference in the people. As a matter of fact, they stopped the trial early because it was very apparent that the people using the inhalers had a strong enough outcome to not continue with the trial because it was very clear that it was making a difference. And this probably makes sense. We've known this all along, and yet that inhaled steroid is not still in routine use. I want to say that the World Health Organization, for the first 6 months of the pandemic, actually said to not use inhaled corticosteroids. But you notice those numbers, that 10 and 1. I've certainly put out data on the vaccine for COVID. And in that trial, for the Pfizer trial, we had some, I think it was 19 and 19,000, so 38,000 people, and we had about the same numbers. So, 10, but you're looking at, in this case, 139 people with huge, in a smaller group of 139 people, we saw 10 and 1. And in the huge trial with the Pfizer, we saw it was 10 and 1 9 and 1, 10 total, 9 and 1 out of 38,000. So you kind of look at a lot of what we're doing doesn't make sense, and there's certainly, anytime there are financial incentives, you have to question this massive push for vaccination when we look at these inhaled steroids, which have been around forever and very inexpensive, readily available, and has like I want to say hundreds, but a seriously stronger benefit in people versus what we saw, at least in the initial data that Pfizer provided to the FDA. Just throwing that out there. So as always, I will post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs this information, and subscribe to the channel.